Welcome! This video is a short introduction to Colorado's Essentials for Childhood project, which promotes safe, stable, and nurturing relationships and environments for all families. My name is Sarah Hernandez. I work at the Colorado Department of Public Health and Environment and coordinate the Essentials for Childhood project. So what is Essentials for Childhood? We're receiving funding from the Centers for Disease Control and Prevention. The Essentials for Childhood framework is CDC's strategy for preventing adverse childhood experiences, including child maltreatment. The focus is on promoting safe, stable, and nurturing relationships and environments. Essentials for Childhood focuses on primary prevention, which is directed at keeping problems from occurring in the first place. This is also sometimes known as an upstream approach. This is a 5-year project, and Colorado is one of only 5 states to be awarded funding to develop this model approach. The purpose of this project is to promote safe, stable, and nurturing relationships and environments. Safety, stability, and nurturing are 3 critical qualities of relationships and environments that make a difference for children as they grow and develop. Safe, stable, and nurturing relationships can also be established in environments that children encounter outside of the home, and also extended to relationships with caregivers other than the parents of the child. Providing these types of relationships and environments outside of the home, for example in high-quality childcare settings, might have the potential for buffering the lack of these inside the home. Promoting these types of relationships and environments can help prevent child maltreatment and other adverse childhood experiences. It's also important to note that these types of relationships and environments are important for adults as well. These extend to the workplace and include relationships between employers and employees. These qualities were identified by the CDC based on years of research. The full report can be found on the link at the bottom of this slide. What makes Essentials for Childhood different? Well, this slide features a look at what is called the social ecological model. It's a framework that public health uses to think about problems at multiple levels of influence and to guide where to focus different types of attention for preventing problems. Everything at the outer levels ultimately affects individuals and families, but we are focused on changing the broader environment rather than focusing one by one on families. While we recognize that working with individuals is very important, there is already a lot of activity doing that. What makes this effort different is that we are focusing at a broader level and getting at those factors that affect everyone. To do this means working on changing policies and changing the way people think about children and what are culturally appropriate ways to support children. We will be thinking about how to make changes in organizations, for example in businesses or school practice and policies, as well as state or local policies that affect how successful families can be in providing safe, stable, and nurturing environments for children. We are using a population approach, meaning that we are targeting change that impacts all members of a community. So this slide shows the Essentials for Childhood goals. The first is to raise awareness and commitment to promote safe, stable, and nurturing relationships and environments. The second is to use data to inform actions. The third is to create the context for healthy children and families through norms change and programs. For example, there are ways that people are used to thinking. Some people may not think it's their business to interfere with others' kids. In order to change that social norm, we need to create a new norm, which is that we all have a responsibility for helping kids thrive. An example norm we want to increase is, it takes a village to raise a child. The fourth goal is to create the context for healthy children and families through policies. Some example policies that we may focus on include increasing family-friendly business practices or statewide policies, such as increasing access and affordability to childcare and healthcare. Basically, we'll be looking at what parents need to meet their needs and to buffer feelings of stress and anxiety through these types of policies. So we're using what's called a 2-generation approach for Essentials for Childhood, meaning that we're focused on kids as well as adults. The idea is to support today's adults so that tomorrow's adults grow to their full potential. I've also mentioned that we'll be targeting the communities where people live, work, and play, and the society blanket that covers all of those communities. We'll explore what happens when families don't feel supported and try to make sure that they have the resources they need through policy and systems change. The purpose of Essentials for Childhood isn't to create a new program that's going to address everything. but rather to look at building a stronger network of support by connecting the dots of existing work and coordinating a shared vision to enhance all of the good work already going on in Colorado. Essentials for Childhood is not a program in a box. It's a philosophical shift. It changes perspectives and the way that we do business. It brings together diverse partners to come up with innovative strategies and then uses an upstream approach to help children thrive. This slide introduces the concept of collective impact. Countless nonprofit, business, and government organizations each work to address social problems independently. This is described as isolated impact. So instead of working in isolation, collective impact brings together traditional and non-traditional partners who work toward a shared vision. They also use shared measurement to measure success throughout the process. Collective impact is really a great approach to solving complex social issues. It's a very intentional way of collaborating. One distinction of collective impact from other types of collaboration is that there's a dedicated backbone organization who coordinates the entire effort. This is a very systematic approach that focuses on the relationship between organizations. The idea is that we can leverage much more when we work together than when we work in isolation. As I mentioned previously, collective impact is an approach to solving complex issues. We're bringing together an innovative team of people and referring to it as our collective impact team. This team is very solution-oriented and sees opportunities instead of barriers. It's also strength-based and looking to build on what resources and assets we already have. The team is also diverse and includes perspectives across communities, cultures, and sectors. So the Centers for Disease Control is providing Colorado with enough funding to coordinate these activities, but unfortunately funding isn't currently available for us to be able to pay partners who are involved. This slide shows the collective impact structure that we're using for Essentials for Childhood. What we are calling a collective impact team is a diverse team of people from lots of different sectors who come together and approach change in lots of different and innovative ways. This is the large body that you see in the yellow square. The Colorado Department of Public Health and Environment is the organization coordinating the entire effort, and they are referred to as the backbone organization. The Leadership Action Team is the decision-making body and provides overall guidance for Essentials for Childhood. It's comprised of about 10 individuals representing nonprofit, business, healthcare, and government agencies, including the Colorado Department of Human Services. You can see that the heart of the work really happens through the collective impact team. Most of the time, one organization can't have this kind of large-scale impact all on its own, but there's power in numbers. The shared agenda and strategies of this initiative will be created collectively with the entire collective impact team. The team will identify strategic priorities by September of 2014. The sectors listed on this slide are just examples of the kind of diversity we're looking for in this initiative. So this project began in October of 2014, and as I mentioned at the beginning of this presentation, it's a 5-year project. In this first year, we've already brought together a leadership team, and we're currently building our collective impact team. We're also doing lots of research and using data and existing resources to plan our approach. In August of 2014, we'll have a prioritization process to narrow down the project scope and strategies. By September of 2014, we'll have an action plan in place for moving forward over the next 4 years. Then, in years 2 through 5 of the project, we will be dedicated to implementing the strategies that we identified during year 1. Again, we're not looking to create a new program. We're called to learn about what's already happening in Colorado and then base our strategies on how to best harness the momentum of existing programs and initiatives. If you have any questions, please feel free to contact me. Thanks for your time and for listening to this introduction on Essentials for Childhood.